and welcome to another Phia Group webinar. As you can see on that slide, it is our 20th year of existence, and I feel like I've been in my basement for about 20 years too. I mean, just so everyone knows, I'm literally back to where it all started. I started my company in a basement. I'm in a basement right now. This basement's a little nicer, a little prettier, a little bigger, but it's still a basement. So, folks, what are we going to talk about today? And Matt, let's go to the next slide. Today, we're going to focus on a couple things. One, reasons for optimism. I don't know about you, but I can't watch Tiger King anymore. I cannot watch the news any longer. Everything's depressing. Everything is bad. All bad news. So, Ron Peck said to me, he goes, why don't we have a webinar with some good stuff, like positive things that are happening, things to keep us in perspective. And I said, you know what? That's not a bad idea. It actually makes a lot of sense. So if you received our newsletter, I believe that was sent out yesterday, you would see that, based on what I talked about and some of the stuff we put in there, there are a lot of things, obviously, that we should all be happy about and proud of and thankful for. So that's what we figured we're going to focus on today. In addition, let's go, Matt, next slide. We want to make sure that we help the entire industry, all of you, brokers, clients, employers, whoever it might be, to do whatever you can to stay ahead of the COVID-19 information, the questions. The number of questions that we have seen on COVID-19 as it relates to the employee handbook, the plan document, et cetera, has been incredible. I mean, the numbers have been astronomical. We have the information, everything from even assisting companies on questions relating to the CARE Act and how to apply, all that fun stuff. So a lot of stuff as it relates to COVID-19, and obviously the things that don't relate to COVID-19, which we almost all have forgotten about over the past 6-7 weeks. Feel free to email us at pgcreferral@phiagroup.com with any questions you have related to COVID-19 or anything else you hear today or anything else that we potentially do. Okay, Matt, next slide. Getting a lot of notes here thinking, happy that we're doing this webinar today. Well, we're trying to do our best. All right, overview. We're going to talk about Phia's response. What have we done internally? What's worked, what hasn't? The latest on the pandemic, industry impact, good news for the industry. So what we've seen from the government as a response, testing and clinical trials, also some political stuff. I can't even imagine who on our panel here is going to talk about the political stuff. But all I know is this. I am just happy that right now I can't see Brady because I would have to then see that really tight Phia fleece that he wears at every single webinar. That thing needs to go. That thing needs to be upgraded and changed. So let's see what happens there. In addition, the last thing we want to talk about is some opportunities with self-funding, direct primary care, and then two organizations, Rightway and Scripta, that we've been working with. You're probably wondering, who's Rightway and Scripta? Well, folks, they've been around. However, we didn't really want to share any specific details until we had a chance to work with them, implement them on our own self-funded plan, and then actually see some results and some success stories. So I think we've done that. And we'll be talking about that in a little bit as well. So who's speaking today? I guess you couldn't even imagine. Matt, let's go to the next slide. There's that handsome guy on the left. That's me. I'm trying to think the last time I actually wore a suit or actually wore something other than sweatpants. I'm wearing right now, folks, if you're wondering, I have sweatpants on, a dirty t-shirt that I spilled some juice on, and some nice Nike sneakers. But I'm definitely not wearing that beautiful suit that I had on right there. In addition, we have Mr. Ron E. Peck. Say hello, Ron.
Hello, Ron. I'm wearing that suit right now, Adam.
Yeah, I doubt it. I don't think that suit fits you anymore, Ron. I don't know how you been holding up with with being at home so long. You been working out, keeping in shape?
Yeah. I'm in a shape. I think it's I don't know what shape it is.
We should have had a couple survey questions in regards to how we all look now. Next, want to make sure we introduce the amazing. I really doubt she's wearing this. I'd be surprised if we don't hear a kid screaming in the background. The amazing, the incredible Jennifer M. McCormick. Say hello, Jen.
Hello, everyone. The kids are sleeping, so hopefully we're going to be good for a little bit. Fingers crossed.
Sleeping? It's 1 o'clock, Jen. What did you do? What kind of medication did you give these kids?
It's a nice little cocktail. I won't give it away, but if anyone has questions, please feel free to email.
Give it away.
Let me know.
If anybody wants to know
at PhiaGroup.com.
Yeah, send it to Phia Group. No question. We will definitely share that cocktail with you. And last but not least, and Brady, you got to let me know if you're wearing that Phia fleece right now. To talk about politics,
I'm not.
all COVID-19.
I'm not.
You're not. Oh man, hold on.
Absolutely
Say
not.
hello to Brady Bizzaro. Say hello, Brady.
Hello, Brady.
So, folks, obviously that did not go as well as it normally does if we're all sitting in the conference room. So that's too bad. But a couple things. One, some more optimism. Folks, guess what? When we here at Phia actually do return to a physical location, not just my basement, we will be in a new office. We are moving to Canton, Massachusetts. We have the entire building, over 50,000 square feet. We are excited about that. So we will never have to go back to our old dumping grounds. But really good. That's really optimistic. It's really good stuff that we wanted to share with the industry as well. Okay, so next slide. Matt, why am I talking about ICE? All the COVID questions, every one of our ICE clients, and you know who you are, 50% of the questions we get are from our ICE clients. They get all those answers for free. They get it all timely. Everything, complex claim issues, plan assessments, plan documents, third-party contract analysis, whatever it might be. Next slide, Matt. But this is the key. All the HR-related stuff, all the consulting, the best practices, that all tie into all the changes that will need to be made either now or in the near future as it relates to your health plan and your employee handbooks. Wanted to make sure I brought those to both of your attention. In addition to that, if you don't mind, Matt, next slide. This is free of charge. We're noticing a huge uptick in the number of people that are getting PACE certified. I'm not sure if it's because they just aren't working as much and now they got extra free time, or maybe they're just trying to find a reason and excuse to get away from their families and their kids. So they, hey, you know what? Let's get PACE certified. So folks, on this call, I'm going to give you some free advice. If you want to have an excuse to have some more alone time, tell your family that you have to get PACE certified. There's 3 chapters, a lot of studying, and you just need to be all alone. Let's see if that works. Here's one thing I did notice, though, which I think is pretty interesting, is that our company, you know, we're looking at productivity and all that stuff. You know, one of the key things that we've noticed is our productivity for many of our departments has gone up, way up. And I'm like wondering, how could that be? How could it be that people working from home are actually more productive now than they were prior to us, you know, going through all this? And then it made sense. They'll do anything to get away from their spouses, their family, their mom, whoever they live with. And they're like, you know what? I have to go back to work. So they're actually doing extra work, stuff that's not even due, which I think is pretty nuts. Anyways, next slide, Matt. The weird part about doing this, like I feel I'm talking to myself. I probably am. Follow us, please, on LinkedIn. Matt, I know there's thousands of people that are following us now on LinkedIn. Go on there, search for the Phia Group. You can see all the cool stuff. You'll actually see our latest newsletter that we just put out. And on there, you'll see my daughter. If you want, go on that newsletter. You'll see a video. It's my daughter dressed up as Wonder Woman, and that was her school project. It was so good. I'm like, you know what? I'm going to share this with the whole industry. So please feel free to listen to our to read our newsletter and check us out. Next, about listening to us. Listen to the podcast. A lot of podcasts have gone out related to COVID. Brady, Ron, Jen, and our team have done a great job as it relates to it. So please reach out, go on, download the podcast, and listen to all of them that go back for many, many years. Okay, we would never have a webinar without thanking one particular individual for listening. So, a special shout out to Tracy Foss. Tracy, are you there? If you are, please send us a little texting so we know that you're watching and you're listening. Matt, please make sure whenever you have the ability to go back into the office, put together a huge care package and send it over to Tracy. Tracy told us that last October, I took the trip of my life to South Africa. I spent 10 days traveling around on safari. The people were awesome, but the animals were amazing. It's great. I watched Tiger King too. Joe Exotic is pretty cool. That's my trip and my time at the safari. But thank you so much, Tracy, for listening. We appreciate it. Looking forward to seeing who we pick out for next month. The next slide. This is something new. Folks, I happened to get in the mail one day this book from Troy, not that thick. You can read it. It's a quick read. But I thought it was really good. I was pretty impressed. I actually picked up the phone and just called Troy up and I said, hey, this is really good stuff. I think that you should have as many people as possible in the industry should have the opportunity to read this and know about it. So I basically said, hey, listen, how about we talk about this on your webinar, bring it up a slide. And he thought it was a great idea. It's a great intro to self-funding. It has great information on how to become a better healthcare consumer. And it just talks about, ways to reduce out-of-pocket medical costs. Great read. He's a great guy. And feel free to go on reimaginebenefits.com to order yourself a book. All right. Next slide, Mr. Matt. So what's been our response? So as you all know, we have over 200 people that work at Phia. In our main office is over 160. And, it was a pretty crazy time when we had to all of a sudden quickly transition. As you all know, Massachusetts is a hotbed for COVID-19. I would imagine that we're going to be the last state in the country to actually be able to get a haircut. Speaking of which, if anybody wants, I can actually share a photo. So all of you know that I love the Cleveland Indians. And Ron, I didn't even tell you this. I didn't tell anybody at Phia this. So my entire life, I've loved the movie Major League. Love the movie. And Charlie Sheen was the wild thing, as you all know, in Major League. I named my son Sam. My son Sam's middle name is Vaughn, after Rick Vaughn from the movie Major League. But I've always wanted that haircut. That haircut to me was like, if I could ever have it, I'm going to do it. Well, obviously I couldn't have it while I was in law school. I couldn't have it because I had a job, working at law firms and all that fun stuff. I mean, you literally can't go outside with that haircut. But I bought myself some buzzers on Amazon. They arrived pretty quickly. And my wife and my sister gave me the Rick Vaughn Wild Thing haircut, which I currently have as we speak. It is awesome. And my family, my kids think I'm nuts, but I absolutely love it. And just wanted to share all that with you. Anyways, what we have basically done is have a virtual office. Everyone works from home. Like I said, productivity is up. Access has been great. We have weekly staff meetings, video conferences, all that stuff. I mean, that is huge for us. And what we've noticed is actual morale is up. We've seen more and more people optimistic, more people thankful for having a job. We're still hiring. So what we've also done is encourage every single department, every team to have their own social Zoom meetings, social hours, trivia, etc. Employee training, everything done virtually. So what we've done, what's the cool part of working from home is that we were actually able to test out all these things to see, what would happen if there was ever a disaster. Well, we didn't have to worry about, a disaster, training. We didn't have to simulate it. We actually are going through it. So that's been our response. If anybody wants any information in regards to how we did it, any tips, etc., please feel free to reach out to myself or to Ron or Joe Montalto at our office. And so far, in regards to what we've done, I'm very excited and very proud of what our team was able to accomplish. So that's it for me for now. I'm going to turn it over to Mr. Peck. Ron, this is the earliest I've ever seen you have a slide. I'm pretty impressed. I'm not sure,
Well, Adam, it's a bit of a trend, Adam, because if we jump to the next slide, you'll see during the last webinar, the first slide I was assigned was the map of the United States with all of the pandemic hotspots highlighted with these bullseyes, like big ones and small ones, and it literally looked like Cold War Soviet strike map. And once again, I've been assigned the map that literally it's not quite as bad. So thank you, Brady, our chief of graphics. But again, it's been assigned to me to look at the United States and deliver bad news. At least that's what the slide would imply. And, it goes without question, obviously, before we start to talk about all of the silver linings and optimism and things to try and take a positive spin on what's going on in general in the industry, both politically, legally, and otherwise, it's important to note that, of course, this is not a fantastic time either for the industry or in general. The number of cases, deaths, illness, economic strife that we're suffering. Of course, the disease itself is horrific, but the albeit justifiable response to the disease is taking a toll as well, clearly from an economic standpoint and in my case, psychological standpoint. But without really ignoring, we don't want to ignore what's going on from the negative impact side. We did feel it was important to try and take a look at what's going on and update you and give you at least some glimmer of hope for when we do come out of this, which we will. We will come out of this. So let's go on to the next slide, Matt.
Hey, before you do that, can you go back there real quick, Matt? I'm just jealous of all the people in yellow. You know, I mean, I am. I mean, look at we are. I would do anything to be in some yellow spots. So that's all I wanted to say. Go ahead, Matt.
So moving on, looking at again some of the negative news, and again these are statistics that you hear in the media, you hear being discussed, things that obviously are not great news, things like unemployment, the fact that we've seen more unemployment in the last few months than we have seen job growth in years, just sort of wiped out this economic growth that we were enjoying. The number of people who, as a result of losing their jobs, are also losing their health benefits, and the timing couldn't be any worse, right? It's sort of a double whammy, right? One, it's a health crisis, right? If this was just an economic crisis, but there wasn't a pandemic and people were losing their jobs, they would at least be saying, yeah, I don't have health insurance, but I think I can make it by without health insurance for a little while. But because this economic strife, this downturn is being caused by a health crisis, it's, like I said, a double whammy. Not only am I losing my health insurance, but it's at a time that I need it most. That being said, and in the spirit of optimism, I do want to point out that the self-funded industry in general, and of course there are exceptions, in general has really shown its true colors in response to this crisis. The number of TPAs, brokers, employers, advisors contacting the Phia Group asking, how do I expand eligibility? How do I expand coverage to employees who have recently been laid off, to employees who I'm about to furlough? How do I reduce the cost of extending benefits through COBRA? The fact that these self-funded benefit plans had already implemented so many cost containment measures to make it more affordable so that people who have lost their jobs were able to afford COBRA. Things like that. Employers now who are saying, I'm just scraping by at this point, trying to keep people employed. The fact that their self-funded health benefit plan is not as major a draw on their resources as somebody who's paying through too much for a traditional insured policy, that they're able to keep people on because the costs are lower for their health benefits. You know, while this is a terrible time in general, like I said, I think it's been an opportunity for self-funded plans and employers who self-fund their benefits to show that there really is something to it, and it's helped everybody involved. That being said, of course, we do expect both during and after the pandemic costs to rise. But again, looking at the optimism or the silver lining, I truly believe, and we at the Phia Group believe, that self-funded employers with benefit plans who focus on cost containment, effectiveness, efficiency, don't just kind of go the old way, but look to new measures. Not only are you going to have a more attractive plan so that when the economy turns around and it's time to hire all of these people who have lost their jobs and there's a sudden scramble, competition for talent, you're going to have that much better an incentive. Something that's going to attract the best of the best is your health benefit plan. But also, you're going to be able to turn the corner on costs because your plan is more cost effective. As a result, you're going to be able to not only afford a better plan, but for less. And that will help you to recover economically as well. So as we go ahead and look at some more. Oh, go ahead.
I was going to say, man, you need to breathe. I mean, you really need people to talk to, huh? Man.
You know, Adam, I got to tell you, as long
I'm just saying, you haven't taken a breath.
As long as I'm speaking out, then I'm not sucking air in, and that's going to reduce the chances that I'll contract the virus.
Oh, my goodness. All right. Hey, how about the next slide, Ron?
So, Jen, if you don't mind, let's start to focus in. We're talking generally about the economic impact of the virus, but obviously, as a health benefits industry, our focus needs to be a little bit more on the economic impact specific to health.
Thanks, Ron. And who better to talk about the math and the financial impact this is going to have than me? Obviously, I'm the right person for the job. So let's kind of dig into this and talk about what these different cost increases could be. We know that, thanks, Ron, that there was going to be the possibility that the healthcare costs for employers are going to raise by 7% in the next year or so. But what is the impact that we're going to expect to see right now, that plans are going to see when it comes to the testing and the treatment for these particular cases and individuals? The good news here is it's better to know than to be surprised and not have any idea. So let's kind of break this down a little bit, because we know that as the virus is going to continue to spread, it's going to actually place even more pressure on our health system that's going to create all these cost increases. So as I'm going to outline here, the basic test cost is only between $50 to $95. So it's less than $100. So as we're seeing more and more tests that are coming available, that are getting the FDA certification, there's a lot more opportunities in different ways for people to actually get the testing. And in a few slides, we're actually going to go into more detail in the specifics about the different types of tests. Remembering that is something that must be covered by a plan. So plans should be expecting to cover the cost of the test with no cost sharing. But good news, the tests aren't that expensive. The variations here could depend, though, however, based on where these tests are actually being administered, whether this is being something that is given in the emergency room or whether this is something that is given by the physician in a doctor's office. So the cost could vary a little bit there, but the actual basic test itself isn't that expensive relatively. We do know that when it comes to whether it's a mild to a moderate to a more severe case, the cost to actually treat those individuals who have been infected and impacted is going to raise significantly. So the mild cases raising from $250 to a more catastrophic case where someone's going to be needing to be in the ICU could be $100,000, which is quite a spread here that we need to worry about. So in coming up with these numbers, there are some variations that have been kind of factored in here, which I thought were important to mention, and that being that there are lots of circumstances, Massachusetts, Boston specifically as one of them, where we're looking to make sure that we can handle in our hospitals and our hospital system the impact to the number of beds and the number of individuals that are going to be treated. So that means, to the best of a state or a health system's ability, we are trying to find ways to put individuals in the right facilities based on the type of care they're needing. So this might mean that there are individuals who are being transferred to maybe a lower cost facility whenever possible based on their particular condition, and that can really help try and balance some of these costs. And that's a great thing to consider, but also something based out of necessity in New York and maybe even Massachusetts and other places across the country. So having an idea of what these numbers are, the cost that it's going to be for the admission and the treatment, $10,000 a day is pretty expensive, particularly considering that there's a wide range of individuals that we expect could be infected, and this could be between 20%, I've seen numbers up to 60%. So that's a pretty wide range for us to consider the actual financial cost that this is going to have. But the good news is, based on whatever it actually is ending up becoming, whether it's closer to 20% or whether it's closer to 60%, a smaller portion of those, it seems like, based on the stats that we have right now, are going to only require that hospitalization. So the majority of the cases that we're seeing are more of the mild or the moderate cases and not requiring that intensive or that ICU care. So the good news here is that this is all something that we are aware of, something we can hopefully try and plan for, as Ron had mentioned, by now considering other ways that we can come up with opportunities to be more creative or innovative with our plan language so we can plan accordingly. All right, I'll turn it over to you, Brady, for some even better news.
Great, thanks, Jen. And unlike everyone else who's spoken, I don't have any problem with my slide at all. I'm very happy that I have the good news slide, because the reality, of course, is there are a lot of good things to talk about, despite the fact that it seems like every day there's more bad news. And obviously, as Ron described, this is a very serious crisis. Many people are dying. We're not really even over the hump yet, but keep this in perspective. I think it's important for you personally and for the industry to know that we know how to slow the spread of this disease, right? This is, it's called the novel coronavirus, but there have been SARS-like diseases in the past. We have an idea how to stop them. As we know, and as we're all practicing social distancing, countries that have done these things have shown to flatten the curve. So places like Singapore, South Korea, it's painful to do economically, of course, and we can't do it forever, but we do know how to slow the spread. That's a good thing. We are working on a cure. We've talked about previously that the federal law has now required plans to cover testing. When we eventually have a vaccine, plans will be required to cover those as well. We're not there yet, but we're working on it. We have literally scientists around the world that are working nonstop. In China, I think the first U.S. clinical trial started last week in Seattle. Johnson & Johnson's working on a vaccine. It's really going to be one of the fastest vaccines ever, but we're still months out. And this was on one of the slides that Ron had at the beginning, but keep in mind, people do recover. I think nationwide or worldwide, rather, there have been over 500,000 people who've recovered from this. And the truth is that most people who get this disease will recover. So that's a good thing. And testing is improving. Jen will have a lot more on this a bit later on, but testing is really the key to unlocking the economy and therefore helping our industry and really all industries. We're up to, I think, about 160,000 tests per day. I read a report from Harvard the other day that said we need maybe up to 5 million tests a day in order to fully unlock the economy and get things back to where they were. But every day we're making progress. That's a good thing. And the testing is getting more easy, faster to do, and it's covered by the health plan. So that's a good thing for people across the board. And Congress is passing legislation. This is surprising to me, despite the fact that it's not been perfect, just how fast the government is responding in terms of legislation. The amount of money that we're just spending to combat this crisis to help small businesses. I'll talk about that in a few slides later, but it's really important to note that we're going to be seeing a lot more bills passed to address the really serious economic turmoil that we're facing. But if you've been reading the news like I have, you're hearing that most experts think the economy will bounce back pretty fast from this. This is really a medically induced coma that we've pretty much put ourselves into. And this is not a natural recession. So we do expect that there will be a big recovery for our industry, for health insurance in general, and obviously more broadly for the economy as a whole. And finally, the stories are all out there on your local news, I'm sure, as well, of people just coming together and acts of kindness that are occurring across the globe. And so that's probably the most positive news you can get on this. Let's go to the next slide, Matt. So one thing to note, of course, is last week, the president announced the guidelines to reopen the economy gradually in 3 phases. We've already seen some states that are acting now to reopen things partially. That's going to be the key to fixing the economy and to stabilizing the disruption we're seeing in industries like our own. And we expect that you'll see more of that in the weeks and months ahead. Like Adam said, the red hotspots are probably going to be the last to reopen, but we do have guidelines. And in the next slide, you'll see a bit more detail. We can go to the next slide, Matt. So you've got 3 phases that were outlined. I won't go into them in detail because they're not super relevant in terms of the detail for our purposes, but just keep this in mind that the guidance from the public health authorities is changing week to week. And it's important for our listeners to know that as the economy does come back to life, that you have to be aware of the laws and regulations that are changing and reach out to us for guidance on this. The most important things to watch, or the most important agencies to watch, other than the task force and the CDC itself, I would say are the EEOC and OSHA, because both of those agencies have jurisdiction over employers and the workplace. So the EEOC is constantly updating guidance. Remember, they're the agency that enforces workplace anti-discrimination laws, so including laws like the Americans with Disabilities Act, including things like reasonable accommodations that your employees may be requesting, Title VII of the Civil Rights Act, the Age Discrimination Act, the GINA Act about genetic information. All of those laws are very relevant right now, and there's a lot of questions about them. And the EEOC is, every week, it seems like, posting new guidance to answer your questions, and we're interpreting that guidance and providing answers for you. So keep that in mind, that as your states start to come back online, look to see what the feds are saying, what your states are saying, what your localities are saying, because you're going to need to, depending on the industry that you're in, implement certain procedures to make sure you're in compliance with social distancing guidelines, with workplace requirements, to stay safe and to make sure that, we don't have to close up again. So that's something to follow, and we'll be seeing a lot more about these things in the weeks and months to come. Next slide.
Hey, just so you know, here in Massachusetts, they've closed our schools for the rest of the year. So we won't be into phase 2 at least until late summer, I would think, here in Mass.
Yeah.
Sorry, I know it's supposed to be optimistic. I'm sorry, guys. I apologize.
Yeah, that's not good news.
Right.
Yeah.
Not good news, no. Well, look, depending on what kind of business you're running or your clients are operating in, is going to depend on when you can open and what you have to do to stay in compliance. And we've gotten tons of questions, and we published a lot of stuff on workplace safety and workplace requirements. So be sure to check out our previous podcasts and webinars. But some more good news here for small businesses. This is a big deal, and I hope our listeners are aware of this program. And if they're following the news, if they're not, reach out to us and we'll answer your questions. But this is important because, look, the average self-funded plan is a small business. They cover between 300 and 400 employees. And in the last CARES Act that was passed a few weeks ago, Congress provided some $360 billion for small businesses. Now, the Paycheck Protection Program is a program within the CARES Act that was implemented for small businesses to provide up to 8 weeks of payroll assistance in the form of a loan that would convert to a grant if you use the money to keep your workforce intact. So you can't lay people off, but the money would be available to you to help pay for employees, even if those employees aren't actually performing work if they're home. The idea there is we want to try and bridge the gap between the weeks and months that this goes on and ravages the economy, so that when things reopen, you'll still have employees to bring back, and you'll still be able to keep your doors open in the meantime. So again, if you use the funds for the right purpose, it can become a forgivable loan. It's a big deal. The problem was that the money was gone in 2 weeks. And unfortunately, and this has been in the news as well, a lot of large companies used a loophole to take much of the money. So you had literally companies owned by billionaires that were taking a lot of this money. Harvard University was one that was called out by the president. So just the good news here is that as we speak, literally I have it on a TV screen across the room from me in C-SPAN, the House is taking up an interim bill to provide more money to this program, approximately $380 billion. And this time they've added $60 billion has been set aside for very small banks. The idea there being that for the small businesses that don't have really big relationships with big banks, they'll be able to potentially get some relief, and the money won't go as fast. But I read today that the money could be gone again this time in a couple of days. So it's a big deal, though, because like I said, most self-funded plans are small businesses. So if you can apply, do apply. And we expect I expect this program to be around. Sure. Yep, Adam.
One of the reasons why the money is going to be gone even faster than the last time is because for those companies that did apply, a lot of the delay in that first 2 weeks were the banks. They just did not have the proper infrastructure, implementation process, online, whatever it might be, to get this up and running. A lot of banks had issues there, like very disappointing issues. However, in the meantime, from the last time that the money was depleted to now, banks have been still processing those applications that were first given on the first $360 billion. So what that means is many companies have already been approved, but now the banks were just waiting for Senate to pass this $480 billion. So if you haven't applied, you better do so quickly, because I would think that this money will be gone, like Brady said, in the first couple of days.
Yeah, and like I said, this is being voted on. It's really crazy to watch the House floor right now. You have members going in groups of 10 wearing their masks, voting on this bill. So it's going to take hours to get this passed in the House, but we expect the president to sign it probably tomorrow. And I think this is probably the single most important part of the CARES Act in terms of keeping small businesses intact. They employ half of our country. They represent a big part of our industry, and we really need these companies to stay around and to be able to afford to keep their workforces intact. So this has been described, by the way, as Stimulus Bill 3.5. It's, again, the interim stopgap funding bill. But there will definitely be more bills, even though I've been reading about how some of the Senate Republicans are getting a bit concerned about the amount of money we're spending. I think we'll see another bill, the stimulus bill number 4, and the next bill that's coming out, I think will do a bit more to address the health insurance concerns that Americans have. And for one of the exclusive behind the scenes sort of ideas that are out there to talk about that is Jen McCormick. The next slide.
All right. More good news. What are the impacts going to be for our plans, for our self-funded plans, for our industry? Maybe there's going to be some more opportunities to allow coverage under the plan through COBRA. So continuation coverage is really important. As we've learned, talking about the cost, what the impact is going to be. And maintaining this access to healthcare, to providers, and to networks has been a pretty hot topic, particularly as we are seeing that a lot of companies have been facing a lot of financial challenges and considering whether or not a reduction in their workforce to a certain extent is something that they'll unfortunately have to do, in addition to maybe adjusting their benefits to accommodate their changing needs, or actually the changing requirements and obligations that we're continuing to see as these regulations are being rolled out. So right now, whether or not a plan is addressing what should happen in those circumstances where an employee has hours reduced or is furloughed or laid off, how that should be handled with respect to COBRA currently is actually going to depend on the particular plan language in the underlying plan document. Read it. What does it say? Are there certain requirements for how long an individual, or how many hours per week, per month, per 2 weeks that an individual must meet in order to maintain their coverage? Would the reduction in hours mean that they would still meet that? Is there maybe language that would instead allow for continuation of coverage in the event of a layoff or a temporary layoff? So whether or not this is being treated as a COBRA qualifying event under the current environment and the current plan document is going to be something that must be reviewed on a case-by-case basis. The key to kind of note here, too, before we dig into a little bit more about COBRA, is that termination or furlough or laid off or temporary laid off, by whatever terms you want to use, those are not specific things that are currently outlined or defined under ERISA or under ACA. So it's important to have a clear definition, whether it's in the handbook or the plan document, when it comes to the types of coverage that might be available or continuing coverage that might be available, because there's not a standard or set definition that means the same to everyone. So what is COBRA? We all hopefully should know what COBRA is. It's the opportunity to have continuation coverage for certain employees who have faced a job loss or maybe a reduction in hours. And it not only allows this for the employee, but also for their dependents, whether it's their spouse or their child or whoever it might be in those circumstances. So should that happen, that an individual employee loses their coverage or reduces their hours, under COBRA, they are permitted to continue coverage up to generally 18 months. There's other caveats and conditions based on disability or whether there are certain other qualifying events that could extend it for even longer. The moral of the story is that COBRA is pretty complex. And not only is it complex, but COBRA is pretty expensive, as we'll kind of talk about in a little bit more detail. Generally, it's 102% of the cost, which is 100% of the cost of the care, plus that 2% admin fee. And due to that cost, the complexity of enrolling, it has been something that not a ton of employees or COBRA beneficiaries are opting into because it's not something they can afford, which right now, when this is something that's on the table for those individuals who are losing their job or facing the circumstances, having to face COBRA or not have coverage at all is a really tough decision. So back in 2008, which was a good time or a bad time, I should say, as a result of the financial crisis, there was something that President Obama had put into place to help those individuals when it came to COBRA. He signed the American Recovery and Reinvestment Act of 2009, and that allowed for continuation coverage under COBRA to actually be a little bit more affordable by offering a 65% subsidy. While that was temporary, it was from September of 2008 until May of 2010, that was something that was really helpful for a lot of people. But that was something that was actually implemented before there was ACA, before there were any sort of exchanges. So whether the impact of that is going to be seen now is potentially something that's on the table. There is a new plan. I think right now it's called, and Brady, you can correct me if I'm wrong, the Worker Health Coverage Protection Act. And this would be This would be something that would have some sort of plan in place to allow those employees who had been laid off or furloughed to keep their coverage at no cost to them. And this would increase the subsidies that would be available under COBRA, which is a pretty exciting opportunity for a lot of these individuals who are facing these financial concerns. And this right now could impact millions and millions of people. There are over 4 million people that have lost their health insurance just in the past couple of weeks. So right now is not an ideal time to be facing an insurance loss considerations and concerns. So based on the current plan, as I sort of understand it to be, this is going to cover 100% of the cost of the premiums for those furloughed and laid off employees. They just generally would be when they return to work, then everything would return back to regular and their coverage would continue outside of the COBRA. So this is going to actually have a large impact on a lot of people if this is something that's going to happen. So what's next? This is actually something that we would expect to be favored by a lot of the providers, because if an individual can maintain coverage under their current plan through COBRA, it's likely that they're going to have a higher reimbursement rate. So it seems like this is something that is going to get some likability. People are going to find this to be pretty favorable. And right now, that the other consideration here too, I know that we're supposed to be talking about the good news, is that this could have a large impact, but there are certain circumstances where this wouldn't have an impact. So remember that COBRA doesn't apply to every business. So COBRA doesn't apply to those companies that have less than 20 workers. And also there's still a large percentage of Americans who are getting their insurance through their employer, but there are a lot of places, maybe in situations where people are laid off, where coverage isn't being provided at all. Maybe they're in retail or maybe they work at a restaurant. So while this is a really good news opportunity to continue coverage under COBRA, because COBRA can happen really quickly, it's very easy to continue coverage under COBRA as compared to maybe Medicaid or an exchange, because it offers that continuity, it's easy to enroll, people can keep the same network and the same doctors. Just remember, it won't impact everyone. We'll definitely stay on top of this one, because I think this is an important and big news, good news, when it comes to our industry. Next slide. All right, some more good news. Okay, talking about getting the uninsured some care. So we talked about the unemployed. Now let's talk about the uninsured. So we talked about it a little bit earlier about the CARES Act, and one of the things that the CARES Act did do was it offered some relief for providers. So there was an opportunity for providers who had been allocated some money to kind of log into this portal that's now open, and they can, as long as they agree to certain terms and conditions that we'll talk about in a little bit, they can get payment, they can get their funds. There's about $100 billion in funds that had been set aside for this purpose to help support expenses or costs or lost revenue that can be contributed to COVID-19. And also to make sure, for example, that certain uninsured Americans are getting the testing, getting the care, and getting the treatments that they need. A portion of the funds we're actually supposed to be using to reimburse the providers at the Medicare rate when they're treating these uninsured. So remember, this is being reimbursed at the Medicare rates, which is a lower rate. But the cost to actually treat those uninsured, even using the Medicare rates, that a high projection I've seen is about $42 billion. Lower estimates that I've seen is closer to $14 billion. So we'll see kind of how this plays out. The stat that we've seen is that this is impacting 2 to 7% of the people who are going to require that hospitalization. So the actual costs are a bit unknown, but we do know that there have been those funds that have been set aside in order for those hospitals to get reimbursed for offering the care, the treatment, the testing, whatever is necessary for those particular uninsured. So let's talk about those terms and conditions. This is something that could be interpreted as some really good news, or maybe a no, or still good news though. So these providers who are treating the uninsured who have COVID-19, they can request a claim for reimbursement, and they have to agree to certain terms and conditions. And obviously these are things they put into place to help prevent fraud or abuse of funds. They just have to submit some sort of documentation to make sure that these costs or these funds were actually being used for healthcare expenses or lost revenue, something that is somehow attributable to coronavirus. The good news is that one of the terms and conditions is that they are prohibited from balance billing a patient for COVID-19 related treatment. So specifically, it says the provider must agree not to seek collection of out-of-pocket payments from a presumptive or actual COVID-19 patient that are greater than what the patient would have otherwise been required to pay if care had been provided in network. So, looking at that, there's a broad, many have looked at this broadly to say that they're going to treat everyone as a possible or presumptive COVID-19 case. So that means that these providers can't charge patients any more in an out-of-pocket than what would have been charged. So what exactly actual or presumptive means, we expect to be clarified, because that creates a lot of questions here about the scope and the breadth of this. Many believe that this is something that is intended, although not clear specifically from the text of the regulation or from HHS, is that this is more focused on those surprise bills and not balance billing generally in the broader sense. So how could this happen? So balance billing or surprise balance billing in the COVID-19 context could actually happen, for example, if an individual needs to go to the emergency room and they seek care, treatment, and testing in the emergency room. Even if they go to an in-network facility, in-network emergency room, there could be providers that are treating that patient that are not inside that network. That could also happen if the primary care physician who's in network ends up sending lab work to an out-of-network lab. So there's so many questions that we still need to kind of answer and work out specifically here, but we do know that it was modified from possible to presumptive. So that's at least an upgrade, at least clarify a little bit of what they were getting at. But the scope of whether this is all of balance billing, surprise balance billing, what's going to happen to some of these patients, whether they're going to be responsible for all of these outpatient services or whether this is only for certain testing, that's all going to need to be worked out. But the good news here is that there is the prohibition from balance billing. So I'm sure that this potentially could be worked out with litigation or extra regulations later on, but we'll stay tuned for that as well. All right, next slide, Matt. All right, I'll kind of get through this quickly. I know we have so many great things to talk about, all of this good news here, but let's talk about the testing and the clinical trials. So this is one of the things that Brady mentioned earlier. This testing is key. It's crucial for us to have access to get these tests so we know where we stand and we have the opportunity, the education, the knowledge to get through and open back up the economy. So there are different tests and things that have been done. Brady already talked about the new test that had been approved a couple of weeks ago, the lab in the box, which reminds me of Elizabeth Holmes, but no correlation otherwise, that is going to be able to produce some rapid results in 5 minutes or a negative result in less than 15. That's good news to know about, that there's going to be ways to find out in minutes as opposed to waiting days or hours. The other thing to consider too is that the antibody testing has been on the rise as well. So there's been circumstances, I read articles about this happening in Chicago where hospitals or firefighters are being screened to make sure they can stay on the job. And this is something that actually in Germany right now too, they're doing more of a wide-scale, large-scale testing to figure out if this works. So whether or not this is going to be something that will be mandated for a particular plan is going to be dependent on whether or not this is otherwise going to satisfy the requirements that had been outlined in the previous FFCRA and the CARES Act. And if so, then it's going to have to meet that 100% no cost sharing requirement. As far as clinical trials, this is something that Brady had mentioned a little bit earlier too. We're seeing these in China and then more recently one in Seattle. So those are certainly things to look at because everyone is in a big hurry to make sure there is some sort of vaccine that can be available that we can help to stop this. There are also some antiviral drugs that have been tested and something that is people are paying attention to. One of the important ones here that Brady kind of alluded to earlier was this trial that had been done for remdesivir. So this is something that had been actually developed about a decade ago for another purpose, but in most recent times there has been some really positive results. So outside of these antiviral drugs and these clinical trials, there are certain other ways to do. The last thing I'll say before I kind of toss it over to Brady is that just here in Massachusetts, in Worcester specifically, there was some a situation where an individual over in Worcester received a blood plasma transfer, and she was suffering with a very severe case of COVID-19. And this was something where after this blood plasma transfer, not only was she seeing rapid results, but she was taken off of her ventilator and is now doing really, really well. So in addition to these drugs and these trials, there are other ways that people are investigating. So it's good news. People are recovering, and they're coming up with other ways that we can actually help to resolve this. Brady, I'll turn it back over to you.
Thanks, Jen. And I'll be quick here because I know Ron.
Just really quick, it's Adam. I want to bring up one point. The interesting piece for us is when we are able to go back to the workplace, what will we have to do? What steps will we have to take? Do we have to ensure that everyone has access to masks, gloves? Do we do testing there? I mean, all these kinds of things still have to be digested and discussed, but I'm sure we'll take that on in future webinars. Brady?
Yeah. And real quick on this one, we could do a whole webinar about the Medicare for All Setback. I just wanted to note that it's important to remember that when Jen talked about before this idea for expanding COBRA, I think this would be very likely to pass if by Republicans would support it, because the alternative is an expansion of Medicare or Medicaid for that matter. If you have millions of uninsured people, you've already seen people calling for an end to employer insurance, saying, oh, it's time to, as a former politician said, don't let a crisis go to waste. This is a crisis, right, where people are losing their health insurance. You're seeing people come out of the woodwork who didn't necessarily do it before to argue for Medicare for all. But the biggest person that was arguing for that has dropped out of the race in 2020. We still have an election going on, believe it or not. So that's good news for our industry. And I do think that the efforts that Congress takes to preserve the status quo, to do things like help with COBRA and extend coverage, that's a better alternative than going to Medicare for all. And one last note, someone asked a question before in our comments about privacy concerns related to teleconferencing. I want to let you know that we just recorded a podcast, Ron, myself, and another of our attorneys just yesterday on this topic. So look for that to be posted in a few days, because there are some concerns about HIPAA privacy compliance and using video conferencing software. And with that, I'll turn it over to Ron for some opportunities. Next slide, please.
Great. So you can't spell optimism without opportunity, or maybe you can. But regardless, let's talk about some opportunities. First and foremost, this is something that we don't really have to look into the distant future to see the opportunity now. DPC, right? Direct primary care, sort of unorthodox access to providers. This is something that's been a partnership between the provider and mostly self-funded benefit plans that really support them, has really come to the forefront. You see people in the media, in politics, talking about telemedicine as if it's this brand new concept and this wonderful thing that they're saying, oh, we should really cover this. Meanwhile, self-funded benefit plans that have these relationships with direct primary care physicians not only already have this covered by their plan, but in addition to that, they've taken it one step further, working with DPC physicians who are, telemedicine plus, right? Doing home visits, reducing the exposure that the patient has to other patients, virtual examinations, right? Whether it's through text or video, reducing exposure for both the patient and the provider. Customized care. Again, this is a majorly important thing when you talk about DPC, is the fact that that physician who has fewer patients and is spending more time with each one knows your backstory, knows your history. So they know, yeah, that cough is probably just your seasonal allergies that you get every year. Let's not freak out, versus you've never been sick a day in your life and now you're coughing up a storm. We better get you tested ASAP. So understanding not only your background so that they could better diagnose what's going on with you, but also being able to tailor the approach for your treatment. And the fact that these self-funded benefit plans, as compared to others, are already so well suited to cover things like telemedicine and DPC. This is an opportunity for direct primary care, and it's an opportunity for self-funded plans that work with them.
Hey, Ron, really quick on this too. In regards to telemedicine, what's going to be interesting is now that so many people in our population who've never done telemedicine before, now they're probably getting used to it, right? So how our industry changes, how the typical, office visit changes now going forward, because so many things that you would go for an office visit for previously now is being done either via video conference or telemedicine. It's going to be interesting if it goes back to the old way or if a new approach happens. So interesting. Hey, really quick, Ron, on this next slide. in regards to Rightway. If you don't mind just doing the intro on it, I want to make sure I talk a little bit about background. So, folks, I was introduced to this organization, and what I was very interested in and what I couldn't believe was the information they had as it relates to quality, not on facilities, but more importantly, on actual providers, doctors, surgeons, physicians within a facility. Because not every doctor at a hospital is an A or a B or a C. That's what was really interesting to me as to why we decided to work with this organization, just based on the type of data they had in regards to high quality, low cost physicians. So Ron, I'll let you take it from there as it relates to what the results were since we started working with them in January.
I think, you just said two things, Adam, right? One being about sort of the origin of our working with the organization like Rightway and sort of really focusing in on quality as well as cost. But the other thing you mentioned regarding telemedicine in general also is that now people are being forced to gain comfort levels with this new type of accessing health information treatment that maybe they didn't have in the past and they were slow to adopt. And now it's being forced down their throat. And I think that applies not only telemedicine and DPC, but things like Rightway as well, where maybe people just weren't accustomed to using an app, right, on their phone or a website
so let's
price compare or quality compare providers.
Let's go to the next slide. So
exactly.
Here we go.
Perfect.
So
this is a report from our plan, Adam.
And how much money we've already saved in the first 3 months of our folks going on the app and actually identifying either whether their surgeon or their physician they were going to use for a procedure was high quality, low cost. And you'll see the numbers. I mean, what we've done so far, the amount of money we've saved based on the member interaction with the folks at Rightway has been incredible. We can share all these slides with you folks, obviously, or if you have any more questions in regards to Rightway. But let's take a look at the next slide and just see right here, 113 employee interactions in the first 90 days. 91 completed navigations. The fact that our little plan saved that much money in the first 3 months, we're just blown away, and we're really excited about the opportunity that all of our clients can have work with this organization based on the fact that they're going to help you navigate to the best surgeons, best physicians at the lowest possible price. This is just information that people typically don't have. Another organization that we're working with, Matt, next slide, is Scripta. And Scripta is a healthcare technology company where we're looking basically on pharmacy benefits. And here, very similarly, our people, our outreach, reaching out, speaking to the folks to identify, are there any other, I'm given a prescription, are there any other drugs that I could potentially take that are generic potentially, cheaper, more effective, etc.? And what we have found, and right now there's an incentive on the bottom there, we can get into that another time, but basically we're working with any client of ours that wants to work with them. Obviously there's going to be a huge discount as it relates to a potential contractual relationship. But check out the next slide. And Ron, I want to make sure that we dive into this. We got like 2 minutes left. Is that one employee of ours, just one, we're able to identify roughly $20,000 in savings already. Ron, you want to take the lead on that real quick?
Yeah, sure. So, a couple things worth note, right? The first being that as we talk about Rightway, with whom we've been working for a few months, and Scripta, who we've been working with for the better part of a year, in both cases, these results, that we're showing you are across all of that time. But if you break it down by month, and to Adam's point about people being forced to become comfortable with this kind of new delivery method for health information, it's all taken place really in the last month or two as this pandemic has struck. So I think that from an opportunity standpoint, it's not only the money you can save, but the fact that people are now fertile ground to adopt this new approach. And in particular with Scripta, what they did was they took a look at the medication people were using. They identified instances where people may potentially be able to use a different type of drug or treatment and get the same result. Provide that information to the person electronically, by mail. They take it to their prescribing physician, find out, hey, is this something I can use? And in one case, they were able to identify someone who created $3,000 in savings for out-of-pockets and $16,000 for us. And so that's almost $20,000 in saving just on this one instance, which pays for itself.
Hey, Max, can we go to the next slide? It's our last slide in regards to it.
Yes, thank you.
So
you can see I was just going to say, when you're looking at this, Adam, I want to make sure people realize that if they think that this is something that, their entire population needs to take advantage of it, they all need to engage, but all it takes is one or two big hits to make it worthwhile.
Right. So out of 200 plus people, we've had 10 with potential savings. And what we've seen, 4% increase in generic claim utilization, 3% decrease in brand, 1% decrease in specialty claims. So again, we're talking about a couple months. We've been very impressed with both of these organizations. So if anyone wants to talk to them, wants more information about our success story, and that's the key. We didn't want to share this till we actually saw that this worked. And what we're seeing so far is it does. So I know it's 2:00, guys. We're past our time. Next slide, if you don't mind, guys. We apologize for going over. But our next webinar is the May 19th at 1:00 Eastern time. I will still be here in the basement wearing these sweatpants. So on behalf of Brady, Jen, Ron, and myself, thank you so much for joining us today. We hope you enjoyed it. We hope you got something out of it. Now go back to taking care of those kids. Talk to you soon. Thank you very much.